Hi everyone, it's Megan Chambers here. Just last week, a world-first study was published on EFT tapping for chronic pain. For the first time ever, the reduction in pain that participants experienced was seen on their brain scans. This is really exciting because it shows that it's not just the placebo effect, that EFT really does help chronic pain. So I'll tell you more about that study in a minute, but I first wanted to mention how chronic pain impacts highly sensitive people in particular. So highly sensitive people feel physical pain more than neurotypical people. Sensitive adults start off as sensitive children, and these children are affected by stress and pain more than neurotypical children. Gabor Mate and others have found that children with stressful childhoods are more likely to become adults with chronic pain and autoimmune disorders. This is because they weren't able to fight back or flee from their situations, and that produced learned helplessness and a chronic state of stress. Sensitive children often hear, "Don't be so emotional and don't be so sensitive and stop being so touchy." But they need sensitivity to deal with their emotional states and to deal with the world. So sensitive children learn to ignore their emotions and intuitions because the adults around them can't handle the child's feelings. But this has long-term consequences for their physical health. As I've mentioned, it's linked to chronic pain and autoimmune disorders. Interestingly, because sensitive people feel pain at a lower threshold than others, doctors sometimes can't find anything physically wrong with them, but that's because their instruments are not sensitive enough to measure the cause of the pain. So, despite what doctors say, if you're a highly sensitive person, the pain is not just all in your head. To relieve chronic pain, it's important to release your body's stress response to painful childhood memories. The stress response stays active as long as the memories are active. The good news is that EFT tapping is effective in reducing chronic pain via relieving the body's stress response, and so there's no drugs or surgery required. So now the results of the chronic pain trial. These results were released on the 1st of August 2022. The study was done at Bond University in Queensland and led by Dr. Peter Stapleton, and it showed the effectiveness of EFT tapping for chronic pain. So the trial used fMRI scans, which measure brain activity. There were 24 adults. On average, they had chronic pain for more than 12 years. They did a 6-week online-only group EFT treatment. So that involved education about the psychology of pain and 7.5 hours of tapping over the 6 weeks. And here are the results. They're pretty amazing. Pain severity reduced by 21%, pain interference reduced by 26%, quality of life increased by 7%, physical symptoms reduced by 28%, depression reduced by 13.1%, anxiety reduced by 37.1%, happiness increased by 17%, satisfaction with life increased by 8.8%. Now, the vagus nerve also became more efficient in patients with high levels of pain, and what that means is they got better at calming themselves down. And in those participants who had the fMRI scan, the pain modulating and catastrophizing activity in their brains was significantly reduced. So they took a measure before and after the treatment and compared them. Interestingly, the self-paced version of the treatment worked just as well as the face-to-face treatment. And they've so far followed these people up with the 6-month follow-up. They're currently doing the 12-month follow-up. So at 6 months, the follow-up, some of the participants actually said, "I forgot I was in your trial because I don't have pain anymore." Now, the study used clinical EFT to get these results, which is the form of EFT that I'm trained in. And I'm also a mentor for EFT practitioner trainees who are going through the training created by Dr. Peter Stapleton. So if you want to find out about EFT sessions with me, go to my website, check me out, and you can contact me from there. The link is below. You don't have to keep suffering, and I would love to show you how. Bye for now.